Hi everybody, Lynn Cox here, clinical hypnotherapist. I'm doing a live. I don't typically do lives on Instagram, but I'm trying different methods to get content out there. We are in a very flooded, noisy space. I actually just posted a story about the Calgary police looking to find a perpetrator of sexual assault and talking about triggers. Anytime I see something like that, I just feel viscerally angry. And then below that anger is because sexual assault, any kind of violent assault, particularly sexual, can be so harmful and damaging. And it is beyond the pale to understand how anybody could have those inclinations. But that aside, what I wanted to get on to talk about today is why sometimes talk therapy can be triggering for people. So I'm going to share a personal story as an example, because I do know that a lot of people relate to this. I've seen it, I've heard it. So back in the day, when I was on the beginning stages of working to recover from childhood abuse and then being in a violent relationship, I did what so many people do and started to go to therapy, to talk therapy. I'm going to preface this by saying there's a lot of great therapists out there. I think everybody who goes into the healing, helping, supportive line of work has amazing intentions, and some things work for some people. Not the same thing works for everybody. That's very, very important to highlight. But where I was coming from was a history of childhood abuse at a very early age, like from ages like 4 to 8. And then a lot of typical symptoms that arise from that. And then being in a violent relationship, and there is often a connection with that. I'll talk more about that. So anyway, I went to see a therapist who was noted for having a lot of experience with, childhood, the particular type of childhood abuse I'd experienced. And so I can remember, and this was before I was deeply into yoga and martial arts. And this is important. There's a reason why I'm saying this. So she was exploring, different kind of somatics, so body healing, basically. You hear that term a lot. So I would sit in her office and I could talk about what had happened, what was going on, what I thought about this and that, what I was angry about the childhood abuse. I could talk a mile a minute and share facts in historical accounts. And I do remember she would try to ask me to quiet down and try to tune into my body and ask me questions like, well, where do you feel that in your body? Or what do you notice? And I found this to be extremely difficult, and then it started to get to the point where it was frustrating and angry because I hadn't yet reconnected and reset my nervous system. I hadn't gone through that process yet. So for her to ask me to quiet down and try to tune into my body, it was a bridge I couldn't cross. It was impossible at that point in time. And then it only served to feel frustrating and like, oh my God, I can't do this. There must be something wrong with me. Why is she asking me to describe where I feel this in my body? I don't know. I couldn't feel anything. This happens to so many people who have experienced traumatic abuse, particularly in childhood, to be so cut off from their body and to store pain and memories, and then it can come out in different ways like real tension, these strange aches and pains. One of the symptoms I'd experienced as a younger person was chronic chronic throat infections where I would literally lose my voice. And the parallel to that would be because there was so much I was keeping in and actually couldn't say. So it didn't help me. And it wasn't by fault of her. She was trying to use these methods to tap into your body's wisdom. And I've talked about Body Keeps the Score. That is a brilliant book. And it was groundbreaking research talking about the need for people who've experienced abuse, physical abuse, different types of traumas, to be able to reintegrate the body. So sitting in her office, sitting still on a couch, being asked to verbalize what I was feeling in my body was impossible because I hadn't reset my nervous system and I hadn't done the type of somatic or like body healing that was necessary. And I used to leave those sessions feeling like there was something wrong with me, that it was a bad sign, that there was not a hope that anything was going to get better, because I couldn't even recognize, I don't even know where I was feeling it in my body because I couldn't even feel my body. So that can be difficult for people to, depending on your situation and depending on where you're at, to just be talking without having done some of that body work and healing. So what I had discovered then really helped me turn a corner and then very quickly recover was when I got into yoga, and then I ended up getting certified as a yoga instructor, when I did meditation, and then I got really committed to martial arts, Kung Fu. So I do integrate these practices with people I work with, because if you have experienced that kind of physical abuse, childhood trauma, childhood abuse, childhood sexual abuse, violent domestic violence, etc., many people are extremely cut off and need to kind of reconnect and work through. And one of the things that is so helpful for people is to be able to use your breath in a powerful way, to breathe deeply, to release tension, and then to also be strong and flexible. So the body and the breath can be a real pathway. But just talk therapy, and while I was sitting still on the couch being asked to identify where do you feel that in your body without having kind of made that other breakthrough, it didn't help. And it did only serve to frustrate me. But I kept on going, years and years of therapy, because thinking like, well, this is what you do. You go and sit and talk to a therapist. I think that therapy and therapeutic approaches have come a long way. I'm not dissing talk therapy in its entirety. It can be a really good adjunct. However, if you've experienced physical trauma, childhood abuse, domestic violence, things like this, things where you very likely had a freeze response, and then that got wired in, reconnecting to your body, becoming more strong and flexible, and also particularly with the act of Kung Fu and martial arts, the sequencing and the focus that it requires can be extraordinarily healing. So while you don't have to do contact necessarily, the practices and the sequences, and also the more kind of explosive movements that you can do can really help to dislodge a lot of that traumatic memories and pain, and then reinvigorate people. Because once you start to feel that sense of what it feels like to be in your body and to have that strength and that autonomy, it can really, really fast track other therapeutic methods as well. So just talking and being asked that question without having done that first was a roadblock, and one that was very expensive, time-consuming, and frustrating. And I wish I'd known earlier that there were these other ways to really be able to more effectively fast track and feel better. And then once that connection's established and once certain tensions and things are moved through, so many other things can happen. I mean, we're not just logical talking beings who can recite history and facts. We are whole beings, and integrating the body into any kind of therapeutic approach is really, really important, particularly for people who have experienced physical abuse and trauma. And then just being asked without being able to connect in and know can serve to be a source of frustration. Frustration would be maybe a light term, but also feelings of hopelessness and helplessness. Like, oh God, this isn't working for me. What's wrong with me? I thought we were supposed to do this therapy talking and have something improve. Nothing improved for me until I worked on and integrated the yoga, martial arts, breathing, and meditation. So hopefully that's helpful to some of you out there. Hopefully that answers some questions. I see and hear those challenges a lot. And there are a bunch of different ways, and particularly being able to connect through practice in doing it. So actually doing it, not just talking about it and trying to go in until you've reconnected, will make a huge difference. So I hope everybody's doing well, and I will be on soon. And I'm wondering, how do I stop my live?